Numbness, causes and treatment. Numbness and tingling can affect the arm for various reasons, ranging from sitting or sleeping in the wrong position to heart disease. Treatment for persistent numbness and tingling will depend on the cause. However, unexplained arm numbness may indicate an underlying health condition such as nerve damage, a herniated disc, or cardiovascular disease. Severe causes of arm numbness include heart attacks and stroke. This video reviews main possible causes of arm numbness and their treatments. Poor circulation. Blocked or compressed blood vessels can interfere with blood circulation to and from the heart. Poor circulation can cause numbness and tingling in the arms, hands, legs, and feet. Reduced blood flow can cause other symptoms such as cold hands and feet, extremely pale or blue-tinted skin, swelling in the legs, ankles, and feet, fatigue, joint or muscle pain. Poor circulation is not a medical condition in itself, but it can happen if a person does not move enough during the day. It can also be a symptom of other conditions including atherosclerosis. This condition occurs when cholesterol deposits called plaque accumulate in the blood vessels. Plaque builds up can cause the arteries to harden and narrow, restricting blood flow. Blood clots. This form when coagulated blood clumps together inside a blood vessel. Blood clot can create partial or complete blockages inside a blood vessel. Peripheral artery disease. This is a type of atherosclerosis in which plaque accumulates in the arteries in the arms and legs. Diabetes. This can affect the circulatory system as high levels of blood sugar lead to plaque formation and blood vessel damage. Treatment for poor circulation depends on the underlying cause. Wearing compression wraps can help reduce swelling in the limbs. Exercising can also help improve circulation. People who have large blood clots or several blocked arteries may require surgery. Doctors can prescribe medication to treat underlying health conditions that may contribute to poor circulation. Peripheral neuropathy. Peripheral neuropathy includes multiple conditions that damage the peripheral nervous system. The peripheral nervous system carries information between the central nervous system, the brain and spinal cord, the rest of the body. Peripheral neuropathy causes a range of symptoms depending on which nerves it affects. In general, people who have peripheral neuropathy may experience numbness or tingling in the arms, hands, legs, or feet. Heightened sensitivity to touch and temperature changes, muscle weakness, uncontrollable muscle twitching, muscle wasting or loss of muscle, excessive sweating, feeling hot or cold. Several conditions can contribute to peripheral neuropathy, including diabetes, autoimmune diseases, injuries that cause broken or dislocated bones, atherosclerosis, vasculitis, and other types of cardiovascular disease, hormonal imbalances, kidney or liver disease, a vitamin B12 deficiency, certain types of cancer and cancer treatments. Thoracic outlet syndrome. Thoracic outlet syndrome refers to a group of conditions that compress the nerves and blood vessels that pass between the collarbone and the first rib. The most common form is thoracic outlet syndrome. People who have thoracic outlet syndrome may experience numbness or tingling in a hand, as well as weakness in the neck or arm. Physical therapy exercises that strengthen the chest and back muscles can help improve a person's posture and reduce pressure on the nerves and blood vessels that pass through the thoracic outlet. Doctors can prescribe medication to prevent blood clots and reduce pain. They may also recommend surgery if a person's symptoms do not improve with physical therapy or medication. Cervical spinal stenosis. Cervical spinal stenosis occurs when the hollow space of the spinal canal narrows, compressing the spinal cord. This compression can cause numbness or weakness in the arms or feet. It can also cause neck and back pain. People can develop this condition if they have cervical spondylosis, which is arthritis that affects the part of the spine in the neck. Neck or back injuries and tumors in the spine can also contribute to cervical spinal stenosis. Doctors treat this condition with medication, back braces, physical therapy, and surgery. Herniated disc. A herniated disc occurs when the soft nucleus of the disc slips through a crack in its outer portion. A herniated disc can press against surrounding nerves, which may cause numbness or pain in the arm. Treatment options for herniated disc include pain medication, physical therapy, and surgery. Hemiplegic migraine. People who have hemiplegic migraine experience a migraine headache along with temporary weakness or paralysis on one side of the body. This symptom can appear before or alongside a headache. People may feel numbness or tingling in the leg, arm, or side of the face. Migraine also causes intense throbbing headaches that can affect one or both sides of the head. The symptoms of hemiplegic migraine vary from mild to severe. A severe hemiplegic migraine episode can cause additional symptoms such as confusion, memory loss, personality changes, seizures. Doctors may prescribe pain relievers and non-steroidal anti-inflammatory drugs to treat migraine. According to the National Organization for Rare Disorders, doctors have not established standard treatment protocols for hemiplegic migraine due to being rare. Heart attack. A heart attack occurs when the heart does not receive enough oxygen-rich blood. A blood clot or plug buildup can create a partial or complete blockage in one or more of the blood vessels that supply the heart, causing a heart attack. In rare cases, a heart attack can also happen when the coronary artery spasms, which tightens the vessel and restricts blood flow to the heart. The heart muscle may become damaged or stop functioning altogether if it does not receive enough oxygen. According to the National Heart, Lung and Blood Institute, the most common symptoms of a heart attack include pain or discomfort in one or both arms, intense pressure in the chest, pain in the upper stomach, which may feel like indigestion or heartburn, shortness of breath. Other symptoms to look for include pain or numbness in the back, shoulders, neck or jaw, feeling lightheaded or faint, nausea and vomiting, sweating. A heart attack is a serious medical emergency. People should call for emergency services if they think that they or someone else is having a heart attack. Doctors will attempt to open the blocked artery and restore blood flow to the heart. The exact type of treatment will depend on the location of the blockage, the person's overall health status, and the amount of time that has elapsed since the heart attack began. Stroke. A stroke occurs when something restricts or completely blocks blood flow to part of the brain. Strokes often cause numbness in one arm, leg, or side of the face. Other symptoms of a stroke include a sudden severe headache, vision changes, confusion, difficulty speaking, dizziness, loss of coordination. There are two main types of stroke. Ischemic strokes occur when blood clots or fatty deposits develop inside a blood vessel and restrict blood flow to the brain. Hemorrhagic strokes occur when a blood vessel in the brain ruptures and bleeds into the surrounding tissue. A stroke is a serious condition that requires emergency medical treatment. People should call for emergency medical services for rapid emergency services. A doctor can treat an ischemic stroke with thrombolytic medications that dissolve blood clots. If a person has a hemorrhagic stroke, a doctor may need to stop the bleeding or reduce pressure in the brain with surgical intervention. Depending on the cause, location, and size of the bleed in the brain. In cases of both ischemic and hemorrhagic stroke, it is important that a person and their doctor take care to manage their carefully. Dehydration. Dehydration can cause a variety of symptoms based on how severe the case is. Though it is not likely to lead to arm numbness directly, moderate to advanced cases of dehydration can cause drops in blood pressure, muscle spasms, and dizziness. A drop in blood pressure may cause numbness in the arms. When to contact a doctor? Arm numbness is a common symptom of many minor issues, such as temporarily cutting off the circulation, but it can also be a sign of a heart attack or stroke. People who have a high risk or history of cardiovascular disease should seek immediate medical attention if they experience unexplained numbness or tingling in their arm. Persistent numbness in the arm without an apparent cause suggests an underlying medical problem that may require physical therapy, surgery, or emergency medical care.